My advice to patients in terms of taking charge of their heart disease risk factors is being very compliant and adherent to taking medications and that they take them regularly. And I usually advise my patients, when you're going to see your doctor, you take your medicine bag with you or write down your medications and the doses you're taking and how frequently you're taking them, or take a picture of your medications on your phone and take your phone so the doctor can look at it. It's one way to help prevent medical errors, and it's also a very good way to ensure that you're taking the medications you're supposed to be taking, which will then translate into controlling your heart disease risks. But knowing your numbers is particularly important. Know your numbers. Know the numbers for A1C to control your diabetes. Know the numbers where your cholesterol should be so that your cholesterol is controlled. Know your numbers when it comes to blood pressure, particularly important to know what normal blood pressure should be and what you need to do to control those. Focus on eating a healthy diet, focus on exercising regularly and maintaining a healthy weight. And it's with these healthy habits and patients being advocates for themselves and taking charge of their health that we can make a difference in controlling heart disease risk factors. Heart disease, when it comes to African Americans, is not as much genetics as much as is the environment. I think that there's a lot of things in the environment and in the community that need to be sorted out and put in place to make it easier for patients to free up time to get educated, time to do the things that they need to do to take care of their health. There has to be some policies that are put in place to address these problems in infrastructure and in daily lives of the underserved minority. So when people talk about genetics, it's kind of a pet peeve for me because it's not about genetics as much as it's about the environment that we've created in the Black community and generally in the underserved community. For the young generation of African Americans that are out there and trying to decide what to do, I will say that it's particularly important that we think about heart health and cardiology as a field to go into. Heart disease is the number one cause of death in the United States. Heart disease disproportionately affects African Americans in the United States and overall in the world. So it's particularly important that we say to ourselves, how can we make a difference in our community? How can we take charge of our community? And one way to do that is to train, go to school, educate ourselves, go to medical school, become a cardiologist, and then be able to be that person to our community that's able to take care of the community, that's able to advise the community, that's able to treat our community, and then in that sense, be able to improve cardiovascular care. Part of the reason why we have disparities, we don't have disparities just in heart disease risk or heart disease risk factors or heart disease overall. We have disparities in the sense that we don't have enough Black or African Americans that are cardiologists. If we have enough Black or African Americans that are cardiologists, they will be invested in trying to make a difference in the Black community. And the Black community can relate to them very easily. And it's easier to make an impact. It's easier to do the things that we need to do to take charge, to help get our community to take charge of their health. And even if you're talking about research, right? If we're trying to enroll people in research to understand the impact of different aspects of cardiac disease on overall health, then in order to enroll Black patients, which Black patients don't trust the system, and that's understandable. In order to enroll Black patients, we need to have more Black physicians that are engaged in research. We need more Blacks in leadership positions. And I think that when we have more Blacks doing all of these, then it's easier to reduce the disparities that we have in health overall.